and a mother's pure love at the first sight of her newborn. The triumphant two-step of a cancer-free kid, and the grateful tears of a father who conquered COVID. We've seen MetroHealth's most precious gift. It's more than healing, it's hope. In this year of losing so much, MetroHealth never lost that. What we created instead was more hope than ever before. Hope for each other, hope for our future, hope for all of us. On March 9th, COVID-19 hit Ohio like a sucker punch. 3 people sick on day 1, all in Cuyahoga County. 7 weeks later, Jay Foster, all 6'4", 297 pounds of him, felt sick enough to stay home from work. 6 days later, fevered, out of breath, his heart pounding, he called an ambulance. Told EMTs he didn't care if other hospitals were closer. He wanted to go to MetroHealth. And when he arrived, we knew what he needed more than anything else, a ventilator. Jay knew what that meant. He might never get back to his job helping the guys at the Salvation Army work their way out of homelessness. Might never again see his 2 little girls. Nearly immediately, MetroHealth doctors and nurses began taking calls on our free COVID hotline. Since then, we've answered more than 60,000 calls. We've quarantined thousands. And we've saved who knows how many lives. We cared for the men and women in the Cuyahoga County Jail too. The day after COVID landed in our backyard, MetroHealth Dr. Julia Bruner, medical director at the Cuyahoga County Jail, was meeting with Judge Brendan Sheehan to talk about what had to be done to avoid a crisis.
Before all this, our county jail was looked at as a national joke. And now, because of what we did and how we operated and how everyone came together and collaborated, we were a national model.
In 2 weeks, the judges slashed the jail population nearly in half, while jails and prisons across the country counted death after death from COVID-19. The Cuyahoga County Jail didn't lose a single inmate to COVID. Not one. We've been known for nearly 200 years as a hospital full of do-gooders, and we are. But here's the thing, we're also really good at what we do. Our patients tell it best.
So they told me while I was under that I caught pneumonia. My system, whole body was sepsis. I had an infection in the brain.
We spent night after day after night caring for people like Jay. Many of them had no insurance, but they had hope. They knew MetroHealth could take care of them. Jay Foster knew that too. Jay came off the ventilator, moved to our rehabilitation hospital in Old Brooklyn, worked hard every day until finally, on August 21st, 111 days after the ambulance brought him to our doors, he went home.
I feel like I'm here for a reason, that I was brought through for a reason. It's like a second chance.
This year of upheaval brought us more clarity than ever before. 2020 reminded us that we're not just here to cure disease and heal the wounds of trauma. This is the moment in history to heal our community too, to build a better future for everyone. And what better place to start than in our own neighborhood? The world stopped when COVID hit, but MetroHealth went into high gear, and not just in caring for patients. Thanks to our construction team, the 11-story centerpiece of our $1 billion campus transformation is on time and on budget. It will still welcome its first patient in 2022. And work has started on the 72 affordable apartments on the northern edge of our main campus. The first floor of that building will house MetroHealth's Economic Opportunity Center, where partners such as Tri-C will offer job training classes. 2 other apartment buildings near our campus will follow. But MetroHealth is just one piece of the rebirth of this rich, diverse, welcoming neighborhood around us.
So growing up here as a kid in this neighborhood, I've been here most of my life. Everyone told me find a way to make money and get out. And as soon as you get a chance, get your mom out too. That all changed when Hospital made the announcement that they were going to invest $1 billion into that campus. Today, I can tell you, there's over $120 million of activity in the ground. There's another at least $100 million or so of activity that we are aware of that is coming. And the fact that they've been willing to take that mantle and be the first to the table, right, to invest here, is showing the folks in our community that there's a reason to be here, there's a reason to live here, and there's a reason to stay here. I think one of the most exciting things about the relationship between Metro West and MetroHealth is that they've come to the table and asked, where can we help?
Our job is to ask, not tell, to bring together, not tear apart, to lift up and never displace.
It makes you feel hopeful that change is real and that we can actually have a community that speaks to the needs of our residents.
That commitment to our community goes beyond West 25th Street to wherever we see a need. MetroHealth's new Institute for Hope is preventing illness before it strikes, asking people what they need: fresh produce, legal help, the kind of care that keeps people from getting sick in the first place.
In the same way we're working with nonprofit and other organizations to bring affordable Wi-Fi to families so they can go to school or see their doctor from home, we've worked with the Greater Cleveland Food Bank, the Hunger Network, and Farmers to Families to make sure nearly 10,000 seniors, adults, and children didn't go hungry this past year. When 1,700 of them were quarantined because of COVID, we brought them food. We delivered other essentials too: diapers to new moms, toothpaste and socks to those without homes, free lunches to school kids, medicine and masks, hand sanitizer and cleaning supplies to so many others.
That's what the Institute for Hope is all about. People, not data. But we can't overlook the numbers. 80% of how healthy we are has nothing to do with our doctors or hospitals or healthcare, and everything to do with what we eat, where we live, the work we do, and whether or not we have someone to help us up when life knocks us down.
When MetroHealth sat down with Urban Community School to start planning the health center, we both knew that the best chance
any person has for long-term success is being surrounded by the services they need, delivered by people who care. Urban Community Schools saw a need.
And working together with MetroHealth, we filled it.
Good health is about so much more than good medical care.
It's about creating thousands of Ricardo Leones, young people who might leave to learn, but who come back to create a better place for the people who raised them. and neighbors who treat you like family. A school that knows the best lessons don't come from books, and the beautiful collaboration that's building a community's future. We've seen MetroHealth's most precious gift. It's more than healing. It's hope. In this year of losing so much, MetroHealth never lost that. What we created instead was more hope than ever before. Hope for each other. Hope for our future. Hope for all of us. Hope that deadly images of racism will become a thing of the past, and we can heal our community and our country from the 400 years of trauma that tore us apart.
She pretty much told me, but not just flat out, that they didn't want you because of the color of your skin. And that just kind of like tore my heart apart. I mean, I'm giving up my time, I'm giving up, you know, just wanting to make sure that this person doesn't die alone. But they just didn't want me.
At MetroHealth, we wanted a response to George Floyd's death that was more than just words. Something meaningful and lasting. We began with one simple idea. We would listen. In dozens of meetings, we asked our Black and Latinx colleagues to tell us about the racism they experienced in honest detail. We listened to the powerful stories of those who reached beyond race to create a better world.
So, Coach Rookie stood maybe 5 feet tall. She's a Polish woman with curly hair who is a bundle of energy. When you grow up and things are segregated and you can't see hope, if you have someone who breathes hope into you, that's opportunity. And when you have opportunities, you have visions, you have dreams. People stop dreaming when they don't see anything but despair. And she gave me a chance to see so much more than that. Where would I be without Coach Rookie? I would hate to think. I'm so sorry. I wouldn't be a physician. I wouldn't have been the athlete. I wouldn't have been the student. I wouldn't have been the fighter. To be honest, I wouldn't have believed in people who didn't look like me if it wasn't for her.
We committed to change, to doing everything we could to create thousands more Coach Rookies. We will hire, develop, and promote minorities at all levels of our organization. We will eliminate or substantially reduce health disparities among our patients. We will establish anti-bias and anti-racism educational programs for all employees. We know those are just words, and our actions speak louder. When MetroHealth saw the high numbers of Black and Latinx people being sickened by COVID,
what we recognized is that we could not do anything alone. When we reached out to Dr. Boutros and his team at MetroHealth, the conversation was around testing. And through that mobile testing, we were able to recognize just how widespread it was within our community. I don't think that without the partnership, the infrastructure, and the mobilization of MetroHealth, this would have been a success.
We've tested more than 14,000 people at more than 140 nursing homes, group homes, senior living communities, homeless shelters, and houses of worship. We will continue that testing, and we will continue providing most results within 24 hours. We've worked on income equality too, providing raises in June to frontline staff at a time when many organizations laid off or furloughed their employees. We mentor and job train the high school students in our Lincoln West School of Science and Health, a school in which every graduating senior has been accepted to college. We host an annual transgender job fair. We help create a program that trains Spanish-speaking members of our community for good-paying jobs. In the powerful change, the stark truth of racism leads to, and the beautiful collaboration that's building a community's future, and the grateful tears of a father who conquered COVID. It's more than healing, it's hope. In this year of losing so much, MetroHealth never lost that. What we created instead was more hope than ever before. Today, we invite you to join us in creating hope. There are hundreds of ways to do that. You can volunteer with us or one of our many partners. Organizations that educate, feed, house, and find so many other ways to keep those in need healthy. You can reach out to local, state, and federal lawmakers to change policy, laws, and regulations, not for us, for the people we help, people who need champions like you. You can partner with a nonprofit or other organization and do more good as a team than either of you could do alone. And you can donate. Your donation doesn't have to be on the scale of this year's historic and generous $42 million investment by Joanne and Bob Click. We are grateful for every donation to the MetroHealth system. The important thing is that we all build hope. Hope that nurtures and strengthens our community. Hope that nurtures and strengthens each other. Hope that builds a future so bright it blinds hatred and fear and despair and leads the way to the healthiest future Cleveland has ever seen. Together, we can do that. Together, we can do anything.